From the period 2003 to 2020, there were 7,921 decedents who were identified with prion disease. That comes out to about 1.2 cases per million population, a little bit higher among males, 1.1 for females. When you look at the older age group, as you're aware, this primarily affects the older population. Those greater than or equal to 65 years of age, it actually goes up to 6.1 cases per million, so a little bit more. But another statistic you heard yesterday was that 1 per 6,000 or 1 per 5,000, meaning when we look at all the deaths in the country in 2020, 1 out of every roughly 5 or 6,000 were diagnosed with the prion disease. And the reason I keep mentioning 2020, that is our most recent year of complete data. We're in the process of reviewing 2021 data right now. Preliminary data suggests that it's very similar to 2020 and to 2019, which is a good sign. In 2020, we had 568 cases, 571 in 2019. That comes out to 1.3 per million. We found definite or highly probable matches of 87% of cases in the death certificate data when we were doing this matching process with the Prion Center. And that really speaks to the Prion Center's expertise in increasing awareness of their services, that so many cases of prion disease have passed through that center and had specimens tested there. To give you an idea about our matching process and what that yields, 10 cases had autopsy that were negative at the Prion Center, but still had a death certificate diagnosis, and so they were removed in 2020. There were 40 cases autopsy confirmed at the center that were not found in the death certificate data, and those, of course, were added. So I know there's always a lot of concerns for people where CJD or prion disease did not end up on the death certificate. If they were processed through the Prion Center, we are aware of those cases. This graph just shows the increase of cases during the time period 2003 to 2020. It's not as concerning as it may look to some of you. You do see an increasing trend when you look at the bars there, but I think there's two main factors that can account for this. One, of course, again, this is a disease of the older population. There is an aging population in the United States, meaning each year there are more old people. The boomer generation is getting to that age group, and so because CJD affects the older population, we're simply going to see more cases. There's no real way around that. But also the increasing diagnostic improvements we've seen in recent years, the RT-QuIC I mentioned, MRI, these things are picking up more cases. There's more awareness among providers. Fortunately, a theme of this conference every year is there's still a long way to go, and I certainly have heard that complaint, but we are still trying to get the word out about these diseases.